Do you prefer a clinician or a robot to take care of you when it comes to your healthcare? Recent studies imply that humans prefer robots that act like humans. It's a little bit confusing, so let's talk about it. Hey everyone, thank you for supporting Healthy Bump Club. We have some exciting topics just for you in this new season. Thank you for joining us. Oh my gosh, you guys, I'm so excited. Look who is back on the virtual couch.
Hello.
It is so good to see you back on the virtual couch. It is always a pleasure to have these conversations, and this is a conversation meant to be had. So you guys, and by the way, Olivia, how are you doing?
I'm well, thank you. It's good to be back.
Good
How are you?
You're looking mighty glowing.
Thank you.
Looking mighty gorgeous, if I say so myself. Yes,
You.
it's always great to have you back and have your input, especially when we're having conversations like the one we're about to have. All right, so you guys, there is a recent article that came out in JAMA that really got a lot of this conversation stirring. We know that AI is here. It's no longer coming. It is here. And it is becoming a little bit more integrated in so many industries, and healthcare is just one of those industries. And there's always been a lot of predictions about the impact of AI on the healthcare system. But the recent article in JAMA said that patients who were surveyed, there was 195 random questions that were sent out, and they compared the AI responses or the chatbot responses to human responses. And 78.6% of cases of answers or responses, patients prefer the response of the chatbot over the clinicians. So this got me thinking, and it was really confusing to me because the point of the article was, or of the study said, that they thought that the chatbot responses were more empathetic than the physician's responses and had a higher quality response. So, clinician extraordinaire, hearing this, especially because you're in a field, midwifery is one of those really touchy-feely, kumbaya, humanistic. I feel like you guys and gals are kind of the soul of medicine, if that makes sense. You know, like you guys really touch into that soul part of medicine. So given that, what did you think when you heard this?
I mean, thank you. I love that. The soul of medicine. And midwives we can be all of that. I think, okay, it's so complex. One, I do think that because of the way technology has grown on us and the way that we are so invested in computers and technology, I think it gives us a false sense of security, right? Everybody's on social media, everybody's on computers. We use it every day in our lives, phones, being able to look things up. Mm-hmm. And it's really interesting because the chat AI is an aggregate. It takes everything, right, and kind of gives you a response. Mm-hmm. So it's like taking the best of humanity, if you will, right? The best of our things without our flaws. And by that, I mean implicit biases, explicit biases, right? Implicit biases are things that we are unaware of. So say you are biased against somebody in a bigger body type or certain skin color or fifth pregnancy versus first pregnancy over the age of 40, whatever your things may be, humans are quite complex. So I do think that we have been feeling unsafe with each other for a long time. And somehow we are feeling safer with computers and robots because we think we understand them better. So I think it's really about feeling safe and kind of where we are. I think it really speaks to the distrust that we have as humans and also the power dynamic in medicine. I mean, I think it just can go so deep. What do you think?
Yeah, I mean, I think you touch on some of the key points of just even other studies that came out. And what's really perplexing. So here's the thing, right? I like the part where you said that it took the best part of us, because that's essentially what it is. Like the chatbot is not tired, did not work 24 hours, was not on call, do not have kids at home that are dependent on it. So it is an isolated portion of a human being, right? That also has this limitation in its ability to respond to the changes in circumstances. But so it's like, the concern or the issue is that people are clearly not feeling that clinicians' responses are empathetic or that they have good quality responses. And my thing is, you're not comparing apples to apples, you're comparing apples to oranges, because we are humans living human experiences. And so if I'm exhausted, if I have just been, berated by a client, if I have just had a rough, long day, if things aren't working with the EMR that I'm working with, there are elements to my being that may impact my ability to be more long-winded, be more thorough in my response. I may be stressed out because I have 25 patients to respond to at the end of a 9 to 5 or 8 to 6 day. And so in that sense, you're comparing a robot that has the inability to be fatigued and to have those types of frustrating experiences versus a human being who's in a system that we know has always been a failed system, that has always overworked, underappreciated the clinician in that sense. And so why not just fix the system then? Why not just fix a system where clinicians are working more, have better quality of life, so that when we do respond, you're getting the best of us, not the tired of us, right? You're not getting the overworked response. You're getting the response of someone who had adequate time to get some rest, who have a more balanced life. And so you're getting a higher quality response because my volume for the day is a reasonable volume. My responsibilities for the day is a reasonable amount of workload. And so I think it's just kind of like you're comparing, we still are pretty much avoiding what the underlying issue is. And we're bypassing the underlying issue. And instead of saying, let's fix the system so that clinicians have a more balanced workload, and instead we're saying, let's add a robot. And one of the biggest, and it's perplexing to me because one of the biggest concerns or complaints has been that people feel that clinicians are kind of robotic, in the sense that one of the biggest complaints is like, I don't feel like people are seeing me as an individual, that I'm just a diagnosis. And here we are going to the absolute extreme of that. But to your point, I thought you touched on another point about bias. So let's talk about that bias portion, right? So ideally, you would think that robots would be unbiased. And they did this whole panel discussion with some of the leaders in humanoid robotics. And the robots had the ability to answer the questions from human beings who are concerned about where this whole industry is going. If you have not watched it, you have got to watch that panel discussion to get a sense of exactly where we're going. And what I thought was interesting in that is that ultimately, this question came up in that particular forum. And ultimately, the response that came up with one of the experts is that the robot, sorry, the curriculum almost came out. The robot is a reflection of the programmer, right? So if the programmer has biases, then that robot is going to be, the algorithm of the robot is going to include that level of bias. Now, in the sense that a robot is limited to kind of the sway, is less likely to respond to the emotions of a human being, like we're more likely to respond to each other's emotions. Our robot is isolated and doesn't have emotions, but apparently they're trying to train the robots to learn emotions also. I don't know how that works. But there are some people who are concerned about the ability of robots to be unbiased. The Pew Research Group did a survey in December of December of last year, 2022, and 51% of responders thought that bias actually would get better. They agreed with you. Just a little bit over half the responders thought that biases would get better with the robots. Yeah.
Yeah, that's it. I mean, I agree that they're only as good as their maker. And also, we have to remember that a lot of their responses and the things they get do come from everywhere online. So you have a higher rate of error, you have a higher rate of a lot of things, because you actually have no idea where they're getting their information from. You know how people people who are anti-vaccine, those of us who are like against processed foods, right? One of the biggest arguments is you don't know what's in your food. You don't know what's in these vaccines. Well, it's the same thing with AI. You don't know where they're getting their information from, right? Like there is, interestingly enough, there is a push in healthcare to have more control over your healthcare, more control over your experiences, right? But then if you're saying you're supporting AI, you're giving over that control, right? You're giving over that control to a machine because it can only pivot so much. And you have really no idea with the background, anything like that. So it's a really interesting dichotomy of we want to be seen, like you said, we want to be heard, we want more control over the experiences in our lives and what's happening with our bodies. But I do think it is a sad testament to where kind of we are in our own relationship to each other. I think it is very appealing to think that a machine is perfect and can give us what we need, because we are complex. But what does it mean that we don't want to deal with each other anymore at all? Like, we just don't want to continue the struggle, because it is, for most of us, we come from different backgrounds, different lives, different cultures. But I think in order for humanity to thrive, I think it's been proven we need interaction. We have to be with each other. But it seems like we're kind of going further and further away from that. We want to be with each other less because of our shortcomings. I'm not saying it's there's no good reason for it. That's not what I'm saying. But like you said, I think perhaps we may be going the wrong way. I don't think that there's anything wrong with AI. I think we've been using computer technology forever, right? And in some ways, it has really improved the carry-give communication, ability to get more information. But we have to make sure that our humanity isn't lost and it doesn't become the backbone of our interactions. We still have to be the core of our interactions, because we are human beings.
Right. So 57% of responders in the survey, to your point, thought that the relationship between the patient and the clinician will worsen as a result of the inclusion of AI. And especially when it comes to our marginalized communities where we don't have trust to begin with in the healthcare system. It's important for us to be able to build trust with our clinicians, to build trust with our providers. So if we have part of those interactions be interactions that are mediated by artificial intelligence, then we're taking away those episodes, or we're taking away those opportunities for there to be a trust built between the clinician and the provider, because there's now this third party that lacks human characteristics. And so, whereas I may be able to build trust even just with a casual message sent through my patient portal, and just the way of the response of the clinician may be part of that building trust between myself and my clinician. Now, if I'm only communicating with technology, then we're not learning each other. And it's really important for clinicians and patients to learn each other in order to know how to build a better trustworthy relationship. So I definitely see that AI would damage that. And the question is, do you realistically, what do you think in terms of workload? Will the inclusion of AI, so far for health systems that have already started to include AI on some level, there have been reports that clinicians are seeing that they're able to leave the office earlier, and they're able to complete their work a little bit quicker. What do you think about where this is going? Is this going in the direction where we are actually going to have what we've been asking for, a better life balance?
I mean, it might. I think if used responsibly and correctly, it could be amazing. Like every other piece of technology we've ever had. We don't have the greatest track record of not going to extremes as humans, right? We don't have the greatest track record of finding a good balance and using things responsibly. That's the problem. That's always the fear, right? And it's scary when things are new. I think for this younger generation, to them, it makes all the sense in the world. So I think depending on how you use it, if it's a triage system, if it's how we already kind of use it, you just need refills. There are certain things that you think that's great. But I for one, don't like technology in that way that much. For example, when I call customer service for something, I'm like customer service agent, because I don't even want to hear the automated response.
I'm that person that keep pressing 0.
Yes, I don't even want to hear the automated response.
I want a human.
Because I'm not even in the menu. So like, I just need a quick. So I think that there is a risk of something like that happening, right? It's like I really just want to talk to somebody, because it's like sometimes, and again, I don't know if other people feel this way, but even sometimes like text messaging versus calling. If this is gonna be a long conversation, let's just call each other really fast. I think it would be so much faster, right?
Mm-hmm.
So I think it really depends on your experiences within healthcare, your experiences within the healthcare system. Some of us are very traumatized. Some of us are very afraid. And heck yeah, AI sounds amazing, right? And if I must work with a human being, then that'll be my last resort. Not all of us have those experiences. I think some of us have had somewhere, in the middle, and some of us have had mostly pretty good experiences in healthcare. So think it really begs the question, in these studies, who are we really serving? Who are we interviewing? What are their experiences? So that you really get a good idea of what it actually is. If I've always hated it, if I've always felt like doctors or physicians or people who have seen me have treated me poorly, then you better
Mm-hmm.
believe AI is probably going to be my best friend, right? If they're going to be kind to
Mm-hmm.
me and not make me feel like crap, then I'm all in. But if
Mm-hmm.
that hasn't been my experience, and my experience is I like the human experience, I like my doctor, I've been with the same doctor since I was born, those kind of things, then you are going to feel the loss. So there's a lot of nuance within that. But I do think that, yeah, if used responsibly, our technology can improve our lives. I just don't really believe that we can.
Yeah, yeah. I call me a pessimist. Okay, so I'm one who, like you, really love the interaction with my patients. I love that part of medicine. Is like there's no replacement for it, right? You get to really bond with someone, you get to see them through their journey, and it's really a very intimate relationship. It's a very special relationship between a provider and their patient. As a provider in the healthcare system of America, I am very pessimistic about where this is going, because I feel that history speaks for itself. And when we first started with the electronic medical record, the promise to providers was that this was going to make our lives better. And almost overwhelmingly, providers believe that the EMR has brought hell to our lives, right? And that was the advancement into technology. It was a big shift in healthcare. And now what happened was these systems in healthcare said, oh, you can be more efficient, which means now I want you to document this, I want you to document that, and this and that, because now your grants are dependent on you clicking that button and clicking this button. Your funding is dependent on you clicking that button and clicking this button. And so it has become it's the absolute worst right now. And it has ballooned out the administrative work of clinicians, taking away time that we would ordinarily spend with patients. So I believe that in this capitalistic society that is constantly looking to make a buck and has not shown to value the lives of people, that the addition of AI would just be another way for there to be more requirements, a higher volume of requirements, because now the thought would be, oh, you're more efficient. So now instead of seeing 25 patients or taking care of 25 messages, now I want you to do 50, because the AI is going to help you with some of that. And oftentimes the nuances of the integration with these technology are not quite fleshed out. And so they have this very idealistic sort of fantasy as to what the ultimate results will be, as has happened with the EMR. And the end result was nothing near that. Like literally half of us want to toss the EMR out the window.
Right.
It has made some improvements. It has definitely decreased. The medical error has decreased with the EMR, but the lifestyle and the life balance and the quality of life has deteriorated tremendously. And so I'm definitely concerned about that. And now also with the thoughts of it being included also with our research, and that they're looking to incorporate AI also even in our research. And it first of all, there's this study that was coming out of, forgot which hospital, one of the major hospitals in the US, where there is a scan that can be done, an eye scan that can be done using AI, that would reduce the workload or increase the ability to scan for cardiovascular disease by scanning the eyes. And then ultimately that would lead to a reduction of work volume for, some of the standard cardiology evaluations that are currently being done. So I will say, before I get into the research part of it, I will say that there are concerns about certain jobs being lost, right? There are some people who are looking at AI, the use of AI for doing things that a medical assistant would typically do. So do you want the robot to do your blood pressure and to do your pulse and to ask you how your day been going and how your family's doing? Or do you want a medical assistant? Because that's part of the prediction is that the medical assistants may be the first group in healthcare to be greatly impacted by the incorporation of AI. So we're also talking about job loss, and without an avenue to reinvent those roles. So we aren't really exploring the reinvention of roles that may be impacted by the incorporation of AI, which is very concerning. But then the research aspect, using AI to authenticate research, to review the data in a research. What do you think about that? I'll give that up. Like, y'all can have the robots read those.
I mean, we do it now. I'm getting my doctoral degree, and when you submit something, they want you to submit it in through a program to check for plagiarism, to make sure it's for plagiarism. So it's already here. It's been in academia. It's kind of been a thing. I don't know. I don't.
What do you think about it? What do you think about it, future doctor? What do you think about it? The use of AI they're looking at plagiarism. They're looking at image manipulation. They're looking at using AI to evaluate for even ethics. They're looking at AI to triage some of these research, to triage which ones will be accepted, which ones won't, to validate references, to do some editing. Y'all could do the editing.
Validating of resources is fine. I don't think being the final say in approval. I don't think, because again, nuance and certain things, I don't think a machine should be doing that. A computer should be doing that. But there are some things. Listen, I use a program that helps me make my reference list and all kinds of things like that. There are some things that make it very easy. But even in that, even when you set the settings correctly and you do everything, there are still mistakes. There are still issues that if you look at it, you catch. So I like it for some things. I really do. I do think the only problem, and I remember thinking of this even with calculators in the 80s or 90s, is that to what degree do we want it? Do we want technology to get to the point where we don't know how to do anything anymore? I mean, self-parking cars, self-driving cars, everybody's really excited about this technology that really takes us out of everything. And I understand, because of our errors and margin of errors, tragedies and things happen. But do we want to be useless? Do we want to completely stop being able to use our brains in certain ways? I will say the technology that helps me write my papers, when I don't have that on my computer, honey, it takes me like an hour to do my reference list. Why? Because I don't practice doing it, because the machine does it for me. It's not that hard. I got to Google how do I cite this reference because I don't have the program on my computer. So where it's helpful, it also is limiting because you don't practice these certain kind of things. So you give up a lot. You give up a lot.
Child, we're going down from that 10% of usage of our brain to like 5%.
Yeah. I mean, you can argue if that's good or bad, but
we are rapidly reducing. Okay. I will definitely say, I like you. I do think that there are particular roles that I would be happy to hand over to a robot. A robot can do my billing. Okay. Because that's an area where you can truly get in trouble if it's wrong. If your billing is off, even if you don't intend to commit fraud, you can truly be fined and even be imprisoned with wrong billing. People don't realize that. So I would be glad to have a robot do my billing. I'd be glad to have a robot do my calorie calculation for my patients where we're monitoring their weights and all those mathematical stuff. I mean, yeah, I may get a little bit dumber. Does keep the brain going, but I'll be happy to hand that over. I would be happy for my AI to do all my patient letters and all my disability forms. Listen, you can have that. But the problem is the AI has the inner part of medicine, what makes medicine so beautiful and so great. We've had our issues, but the really beauty of medicine is that it's an art form. And that's the part that we lose sight of because we have become so scientific and so methodical. Part of the grace of medicine where research doesn't fill the gap is in our ability to use our knowledge and pull together an artistic way of approaching someone's disease or artistic way of really thinking about someone's presentation that's may not be consistent with the textbook, but looking at bringing in all that information and coming up with a diagnosis, or coming up with a workflow, or coming up with a management plan that's unique to that particular patient. AI does not have that innate creativity, because I do think that that's a God-given creativity. AI ain't got no relationship with God, not that I know of, right? And I think that us having that spiritual connection allows us to do things that are beyond the textbook and beyond the science. And I do believe incorporate that AI has that limitation across the board. So I don't know how other industries are dealing with the AI, and know it's threatening also multiple industries, including our entertainment industry.
Yeah.
And there's need for laws and privacy. Privacy is something that people are concerned about with AI, because as you know, we've had multiple major organizations be hacked, and people be able to, because there's smart people who can build these AI devices and these chatbots, but they're equally smart people who can hack them. And we've learned that despite all the security walls that all these major companies have, there is somebody equally smart, just a little more devious,
Right.
that is able to use the same intelligence, not for good, but for evil, and are able to hack these devices and gain so much information. So are we risking the possibility of the ability to hack medical information even better? Because I'm not saying it's perfect now. We do still rely on technology to protect the privacy of patients, but does AI increase the likelihood or the vulnerability of our medical information? Yeah, our outcomes going to be better. Would we have better outcomes? 40% of people do believe that mistakes would be fewer. So will we ultimately have better outcomes in medicine?
I don't actually, again, maybe in some places, but for example, think about something like the VBAC calculator, right? Think about something about, think about kidney function and the GFR, the reading for kidney function. So
the GFR.
Thank you. So there are biases that would go into programming, right? There are things that would happen. And so if you don't oversee it, if you're not there understanding, yeah, it can go through an algorithm and do everything it's supposed to do, but there will be an incident or an accident or harm done because it's not about the algorithm, right? It's already about the fact that the foundation is already poor. And I don't know, like you said, it is an art form. I really think that the question comes down to this. To what point do we want this to go? I know we are amazing. We're creating technology, and because we can, people think we should. But the question really becomes, do you eventually want humanity phased out of medicine? Because that's where it's going. And so if you're not careful with that, and the decisions we make, and policy decisions and patient care and satisfaction rates and all of these, if that's what we want, then that is where we will go. But you have to think about what you would give up without the human connection. In birth, I keep thinking, yes, a robot could technically do the techniques that I do, right? The hand skills, yes. But can we connect in those moments when you're about to like break down? I don't know. Can we connect spiritually with a computer? I don't know. And maybe we can. I don't know. But like you said, I think we're selling ourselves short. I really think that we are beautiful creations, and we are meant to connect. And I do think that because of our faults, and because they're so highlighted, humanity's faults are so highlighted, I don't think we highlight enough our strengths and our abilities. And I feel like we're really quick to give those up. I mean, think about yourself as an individual who's listening. How complex are you? Right? You may have some poor interactions, you may have some great interactions, but how willing are we to just give up that in all aspects, like you said, in the arts, in the film industry, in music, and in writing and poetry? How much are we willing to sell ourselves short that we can easily be replaced by what we think are superior, not beings because they're not sentient, but superior machines, I guess?
Ooh, and we're going to leave you guys with that question. We want to know, I want to see what your answer to Olivia's question is. How far are we going? What is our goal? I think that's an excellent question to wrap up with. And I love the fact that you said that we are meant to connect. We're losing track of our humanity and what really is humanity. It's not about crunching numbers and productivity. It's about exactly what you said, Olivia, connecting together as human beings. So that being said, let us know what you think. Where are we going? What is our goal? And is there a line in the sand? Like, are we drawing any line in the sand? Do we have an endpoint? We even have other topics. Boy, they'll make you think about this. Ooh, where exactly are we going? Okay. That being said, Olivia, it's always amazing, soon to be Dr. Favela-Gary. It's always amazing to have you on the couch. You're always making us think. We thank you for joining on again and for hanging out with us.
Oh, thank you. It was a pleasure to be here.
So excited for our upcoming conversations as well. We thank you for watching us. We thank you for hanging out with us. And just a reminder, you can support us by what? 3 ways, either by purchasing our apparel, by using our link for our Apple Music, or by donating directly. Whatever you choose to do, we appreciate your support. And I am Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube, and also the hand behind the handle of Healthy Bump .club on Instagram. So we love you guys. We thank you for watching, and we'll see you guys when next episode.